Hi, this is Modules 5A on organ donations. Today's session is on organ transplantation, a critical area of nursing. The objectives for this lecture are designed to provide you with a comprehensive understanding of your roles and responsibilities as a critical care and emergency nurse in the organ procurement and transplantation. By the end of this lecture, you should be able to discuss the National Organ Transplant Act of 1984, differentiate between brain death and circulatory death, and understand the legal aspects of brain death in Texas. We'll explore how nurses contribute to organ procurement, from identifying potential donors to collaborating with organ procurement organizations. And we'll also look into the roles of compatibility for organ transplantation. Post-operative care of transplant recipients is another crucial focus, where you'll learn about monitoring for rejection, administering immunosuppressants, and providing education to patients and families. Lastly, we will cover the importance of building therapeutic relationships with patients and their families during these challenging processes and examine how to provide support to the families of deceased donors. Okay, now let's get started. So, this discussion is on organ transplantation. I'm just going to start off by saying that this can be a sensitive topic depending on a patient's, nurse's, or family's personal beliefs. There's lots of stories out there about all the good donation does, but then there's also stories out there that people think that it is not ethical in certain situations. So I just want you to know that it's not always a straightforward kind of topic, okay? So organ transplantation not only extends the survival, though, of some patients, but it significantly can enhance the quality of life for the recipients. Today, we're going to talk about several key aspects of this super complex field, beginning with an overview of the National Organ Transplant Act of 1984, which established the framework for equitable allocation of organs in the United States. This act was a game changer as it set up the Organ Procurement and Transplantation Network, some people refer to it as OPTN, and prohibited the sale of organs. Kind of important, ensuring that allocation is based on medical necessity rather than financial capacity. As critical care nurses, you guys need to understand what your role will be in this process, from recognizing potential donors to also supporting the recipients of the organs. We will cover terms such as donor, the person who provides the organ; the recipient is the individual receiving the organ; and organ procurement, which is the process of retrieving the organs to transplant. As we proceed, I want you guys to think about how your role can impact both the donors and the recipients at each stage in the process. Okay, so the National Organ Transplant Act of 1984. This was an important legislation that was passed in really supporting the organ transplantation in the United States. It was enacted to address the growing need for organ transplants and also the ethical concerns that people had surrounding organ donation. One of the main goals of the act was to establish the Organ Procurement and Transplantation Network, OPTN, which that network ensures that organs are distributed based on medical criteria rather than factors like race, financial wealth, and social status. This act also explicitly prohibited the sale of human organs. Now, let's just note that that's not the case in other parts of the world, but in America, you're not allowed to purchase and buy organs, which is a crucial measure to prevent the exploitation of vulnerable populations and also maintain those ethical standards in the transplantation of organs. The United Network for Organ Sharing, UNOS, was designated as a contractor for managing the OPTN, so many acronyms, and they continue to oversee the matching of donors and recipients nationwide. This legislation is significant because it laid the foundation for the fair and regulated systems that we have today, where the focus remains on saving lives based on medical need. Now, as a nurse, you guys need to understand these laws help us advocate for our patients, but they also help us to do it in a way that is both effective and ethical. Okay, so now we need to talk about the difference between brain death and circulatory death. Okay, this is a critical distinction in the organ donation. because brain death and circulatory death need to be defined and understood to be able to go through the process. So brain death is defined as the irreversible cessation of all brain activity, including the brain stem, which controls all those vital functions such as breathing and heart rate. So opposite, in contrast, circulatory death refers to the irreversible cessation of cardiac activity, leading to the loss of circulation. This difference is important because patients who are brain dead can still have functioning organs, making them ideal candidates for donation, whereas circulatory death may impact the viability of organs due to the lack of perfusion. As critical care nurses, we play a vital role in recognizing the signs and symptoms of brain death and initiating the protocols for confirming it. This includes conducting neurological assessments and coordinating with the healthcare team to ensure that the determination of death is conducted according to the legal and medical standards in your area and state. Understanding these criteria is not only essential for you guys and your clinical practice, but also you guys need to understand it for being able to communicate with families during this difficult time. Okay, so to reiterate, brain death is when your brain stops functioning, okay? But with brain death, remember, you still might be able to be perfusing the rest of your body. So all your organs are still getting the blood and oxygen, okay? We say that these patients are ideal candidates for transplant because the organs and everything are still viable. They haven't, had any anoxic injuries. Now, when your heart stops, there's no blood flowing to anything. And we all know without blood and oxygen, your tissues begin to die. Now, just because somebody has had circulatory death does not mean that they cannot donate tissues, okay? That's a completely separate thing. We're talking about organs specifically here, okay? There's lots of things that people can donate. Eyes, lenses on the eyes, skin, tissues, those kind of things. But the most viable, healthy organs are going to be the people that have had brain death without circulatory death, okay? Now, specific to Texas, okay, brain death is legally recognized as the irreversible cessation of all brain activity, including the brainstem, and is considered legal death. The state requires a series of clinical evaluations to confirm brain death, including, but not limited to, neurological exams, the absence of brainstem reflexes, and apnea testing. As critical care nurses, we are often the first to observe the potential signs of brain death and initiate the process of evaluation. This involves collaborating closely with the physicians to perform the required tests and ensure that all the protocols are strictly followed. Accurate documentation is critical in these cases, as it not only supports the medical determination, but also provides a very clear record for legal and family purposes. In addition, you guys, it's important to approach these situations with sensitivity and being professional, okay? So you need to acknowledge that there are emotions involved and that there are some complex ethical considerations to think of depending on the patient's and family's wishes and beliefs, okay? We must also be prepared to discuss the implications of brain death with families, where you provide clear and compassionate communication to help them understand the difficult diagnosis. This is where we're not using words like they've passed on, that kind of thing, because we want to just be very clear so they understand realistically what the prognosis is for their loved one. So in this, you guys, it is so important that you are documenting and that you are following your facility's protocols, okay? If you have any questions about this, A, you'll be trained in the ICU, but B, you can always talk to your charge nurse or leadership team about this. Now, the other thing I'm going to say is in the ER, this is very, we don't go this far. It's very rare we're not going to do all the testing. That's going to be in the ICU. In the ER, it's our job to maintain that circulation as much as possible, even if we think that there's no chance of actual life. We think that they're brain dead. We will transfer them to the ICU because these tests, it's not just one test and done. They're going to do a series of tests over time to maintain and acknowledge and document that the patient doesn't have the brain waves and doesn't have like isn't able to breathe on their own and all those kind of things. So, and the neuro exams, and you want it done by qualified experts in the field, not just an ER nurse or an ER physician. So our goal is to maintain, and I will tell you, a lot of times gunshot wounds to the head, these are ideal candidates for organ donation. That they come in, and we know that, they may have brain matter all over the place, and you're not able, that there's not going to be any quality of life beyond, but we will fight tooth and nail to keep the heart beating in case there is even an option for possibly donating those organs. Okay. So, and then we ship them upstairs to the ICU, and then the ICU does the testing, and you never know what could be the outcome of any patient's condition. And that's why we never immediately do it. But I will tell you that, we're going to get into that in a minute about our specific area in LifeGift and what you guys need to do. I will tell you that you will initiate the process as soon as you think that death is imminent, anytime soon. Like, even if you don't even think it's for a few days, you're going to initiate calling those organizations I just spoke about. And the one for our area is LifeGift, but we'll go over that in a minute in more detail. So, more on your role as a nurse. Okay. So, as a critical care and emergency room nurse, our role in the organ procurement is very multifaceted, okay, but it's essential. Our primary responsibilities is identifying the potential organ donation donors, often based on the criteria related to brain death or circulatory death, okay? Once we have identified a potential donor, we're going to work closely with the organ procurement organizations to facilitate the donation process. This is going to be LifeGift for the Houston area. This collaboration involves communicating with the OPO coordinators, ensuring that all necessary medical evaluations have been performed, and supporting the family through that decision-making process. You need to be effective in your communication because that's key, as families may have questions about concerns of the organ donation, what happens, and they have just tons of questions. And sometimes it takes some time to come to terms with what's going on with their loved one. So our role as nurses is to not persuade the family, but to inform them, providing clear, factual information that helps them make the best decision for their loved one. Okay. We also are responsible for coordinating with the rest of the healthcare team to maintain the viability of the donor's organs and manage any medical complications of the patient and prepare for the surgical retrieval of the organs. Throughout this whole process, though, you need to keep in mind the ethical considerations of the whole situation, and you need to be respecting the donor and the family's wishes, adhering to the legal guidelines. Okay, so now LifeGift. This is the one for our area. Okay, so LifeGift, you're going to hear this a lot. Have you called LifeGift? You're going to hear your chargers. Have you called LifeGift? Have you called LifeGift? I will tell you, every time we have a death or we think death is imminent, you need to be calling LifeGift ASAP. And you document it in the chart that you called them, you notified them. And this is the primary nurse often calls. Can the charge nurse call for the primary nurse if the primary nurse is busy? Sure. But it is the primary nurse because you have the information about the patient. You know what's going on with the patient more than anybody else. Okay. So LifeGift is the OPO, the organ procurement organization serving the Houston area and its surrounding areas. It plays that critical role in the organ and tissue donation progress. Okay. As the designated OPO, LifeGift provides comprehensive donation services to more than 200 hospitals and 10 transplant centers in the area, making a significant impact on the transplant availability in our region. The mission of LifeGift is to save and enhance lives through organ, eye, and tissue donation, with a strong emphasis on community education and increasing awareness about the importance of donation. They work closely with healthcare professionals, including critical care and emergency nurses, to identify potential donors and facilitate that donation process from the start to finish. LifeGift not only focuses on the technical aspects of the organ procurement, but also prioritizes the support for the donor families. They often offer resources like grief counseling, follow-up communication, and also opportunities for the families to honor their loved ones through memorial events. They take a holistic approach, basically, and that ensures that the emotional needs of the donors' families are met while maintaining the integrity and the efficiency of the whole donation process. So in addition to their clinical role, LifeGift is also heavily involved in public outreach efforts and events aimed at increasing the number of registered donors. You guys may have seen them before on campus or at an event somewhere. I remember the first time I saw LifeGift was on campus in College Station, and they were recruiting people to sign up to be donors. Specifically living donors. They were doing the cheek swabs to see if you could be a bone marrow donor or even a blood cancer, like donating like specific kind of things for specifically at the time, like ALL patients. But anyways, so LifeGift conducts like educational programs, community events. They also do media campaigns. You can sometimes see advertisements on TV or through social media, okay, that are going to aim to like encourage individuals to register as donors, to identify it on your driver's license and those kind of things. Put it on your phone in the emergency contacts information that you are an organ donor. So as nurses, you need to understand the role of LifeGift, okay, especially if you're going to plan to work and live in the Houston area. And you need to, you'll basically need to call them anytime you have a patient that is like you think is going to pass, is like imminent death or has died. We call them ASAP, and they will send people out as soon as possible, but they're going to want to know some basic information, like they're going to want to know if the patient had any disease. Like, and sometimes you don't know anything, and you just tell them you don't know. But they're going to want to know like what the cause of death was, if there was any massive trauma or injuries, or if there was a massive illness like infections, those kind of things. They want to know if they're diabetic. They want to know if they've had cancer. They want to know if they've ever had a transplant. There's those kind of things. They want to know if you know their blood type, those kind of things. If you know it, you provide it. If you don't, it's okay. Anyways, so there's all that. And they will, a lot of times when you first call, you're just calling in to start the process, and it's just a call taker, and they're going to take your information, very, very basics. And then the actual, person, the specialist, I guess you could call them, they'll call you back, and they can call you back anywhere between 5 minutes, 20 minutes, an hour, whatever the case may be. And I will tell you, as a nurse, it's always slightly frustrating. You sit down, make the call, and then you get back to work, and then they're calling and you're busy again. And you need to stop what you're doing as best you can and go and answer their questions, because time is of the essence with a lot of these cases. Okay, so nurses play that critical role in both the transplant and the organ procurement teams, each requiring specific skills and responsibilities. On the transplant teams, nurses are involved in the pre-op, intraoperative, and postoperative care, providing comprehensive support to both the recipients and the donors throughout the journey. Okay, so this includes patient education, administering immunosuppressive therapies, and monitoring for signs of organ rejection or complications after the transplant. Nurses on organ procurement teams are primarily responsible for the donor management, ensuring that the organs remain viable from the time of identification to retrieval. This requires a deep understanding of the hemodynamic management, infection prevention, and the physiological needs of the donor. In both roles, strong communication and teamwork are essential, as nurses must coordinate with the surgeons, anesthesiologists, OPOs, and other healthcare professionals to ensure that that streamlined, successful process into the OR. The competencies required, including advanced clinical skills, critical thinking, and the ability to work effectively under pressure. This is not something that's going to be given to a baby new grad nurse, but definitely, I mean, after working a year in the ICUs, you could definitely be the main nurse in charge of the process. So as part of one of these teams, nurses not only support the technical aspect of the transplantation, but also that emotional, psychological support. And I keep saying that, but it's so important that we are providing that to both the families of both sets, the donor and the recipient, because it can be hard on both, okay? Helping them navigate all the complexities and the emotions and everything that's involved with the donation and the transplant process. Okay, so now let's talk about compatibility in solid organ transplantation. We're not talking about blood donation. We're not talking about anything else. We're talking about solid organs, okay? So the compatibility is one of the biggest things that we need to make sure of for a successful solid organ transplantation. And that's going to ensure that the donor organ is a good match for the recipient to minimize the risk of rejection. The first step is the compatibility assessment and blood typing, okay? So that follows the ABO blood group system, similar to blood transfusions. The next thing is going to be tissue typing, which involves human leukocyte antigen, which is HLA. Okay, we're going to do matching to make sure that they are compatible there. HLAs are proteins that are found on the surface of the cells, and those play a critical role in the immune response. So it's like the flags that let your immune system know, hey, I'm part of the body, or hey, I'm a foreign invader, kind of thing. Okay. The closer the HLA match between the donor and the recipient, the lower the risk of organ rejection. Cross-matching is another essential test that checks for antibodies in the recipient's blood that might attack the donor organ. Additionally, donor and recipient size compatibility is considered, especially when the organs like the liver and heart, which can be big or small depending on who is donating, because those size mismatches can affect the functionality of it. Like if you put a full-size grown-up's heart in a small child, it's going to be pumping really strong, and it's going to cause probably pulmonary hypertension, maybe even renal issues. So we have to kind of make size, a consideration as well. And inversely, a small heart won't be able to truly be able to pump effectively for a large body, if that makes sense. So last, the other immune system factors which we need to consider, such as things like previous sensitizations from blood transfusions, if people have been pregnant before, because you can have that Rh factor issue, or previous transplants. Those can all influence the compatibility, and we need to carefully evaluate if that may be a factor. So as a nurse, you guys need to understand the compatibility rules, which will help us explain the matching process to both the patients and the families. And we need to be able to provide them with that clear picture of what to expect during the transplant journey, which if you understand the process, you'll be better able to educate them. So post-operative care is really, really important in the post-transplant process. Okay. So nurses are essential in ensuring that stability and the long-term success of the transplanted organ. One of our primary responsibilities is going to be monitoring for signs and symptoms of organ rejection. So what are those? Those can include fever, pain at the transplant site, abnormal lab results that are in relation to the organ being transplanted, or other changes in the function of the transplanted organ. So nurses are going to be the ones that administer those immunosuppressive medications that prevent the rejection of the organ. But these medications can also increase the risk of infection. So it's kind of double-edged sword here. So you guys need to be vigilant and on top of your assessments, looking for those early signs of infections, okay? You also need to be on top of your education to both the patients and the families, because they need clear instructions on medical regimens, why it's important to take those immunosuppressive medications, okay? They also need to be able to look out for signs and symptoms of complications and how important it is for them to follow up, okay, with their care. Nurses must also manage the complications that may arise, such as hypertension, diabetes, or other side effects from those immunosuppressive meds. So our support extends way beyond the clinical to include emotional, psychological aspects. And I know I keep saying this, but it's so important. So you guys need to be helping the patients and the families adjust to their new reality and adhere to the treatment plans. So by providing that comprehensive, compassionate care, we can help transplant recipients achieve the best possible outcomes. And it's so important that you guys are aware of all these things, and its education is key. So we're going to talk about therapeutic relationships. And I know we've talked about these for other reasons, but again, so important. Establishing that therapeutic relationship builds that trust with the patient, so that when we educate them and talk to them, they're more willing to listen, they're better able to understand, they're also better able to make decisions. One of the things that you might hear from certain people and cultures is, oh, no, I don't want to donate the organs of my loved one. You probably have a family member down the hallway, or you care about some other patient, and you're just going to not even do everything to save my loved one just so that you can go save somebody else. That is not the case, okay? That's like Hollywood. That's not what happens in real life, okay? But we need to be building the trust with our patients so that they do trust us, that when we tell them that that's not how things are, they believe us, and they don't believe what they've seen in a movie kind of thing, okay? So that's the foundation of all of our relationships, is building that therapeutic foundation, okay? We need to be compassionate. We need to be honest. We also need to be open, okay? They need to see that we have all the time in the world to talk to them about things, okay? And you need to also help them navigate the complex emotions that they're going to be feeling. Like they're going to have sometimes hope, fear, grief, guilt. There's all sorts of emotions that are going to come to play, okay? So our role is to create a supportive environment where they can feel heard and respected. You need to be effective in your communication, not only to provide that clear, accurate information, but just listening actively to their concerns and questions. Don't immediately shut them down. Don't gaslight them. Listen. Listen to understand. Don't listen to respond. Okay. So support those families. Okay. And it's a long process, very emotional, and we need to be there for them. Okay. And also, again, consider those ethical considerations they might have. Okay. They might not believe in it. They may not believe in receiving. They may not believe in donating, and we need to respect. Okay. So now let's talk about specifically the families of deceased donors. Okay. They have made a horrifically horrible choice that they probably didn't plan for, that is very, very hard on them. But they've also made a choice that is one of the most amazing gifts that anybody can ever give anybody else in the entire world. Okay. So we need to be supporting these families that are making these difficult decisions. And after their deceased loved one has died and they've donated, that's often one of the most sensitive and important aspects in time periods in the organ procurement process. Okay. Remember, these families are experiencing profound loss. Okay. And every family is unique in their needs. There's no two families that are going to be the same. So as a nurse, you must approach them with the utmost compassion and respect. Okay. Recognize that their generosity in donating those organs is one of the most selfless acts in the middle of their horrific grief that they're feeling. Okay. They're being selfless. They're thinking of others. They're doing good when they're in the middle of probably one of the worst days of their lives. Okay. Our communication should be gentle. It should be clear. It should be empathetic. Okay. You need to be providing information at a pace that the families can handle. Don't just throw everything at them all at once. You need to be just constantly assessing how they're taking things and decide if you need to, come back later, those kind of things. Just be aware of how they are receiving the information you're providing. Okay. It's very important to offer resources and support services to the families, such as grief counseling, support groups, help them navigate their emotions during this difficult time. Calling the chaplain, that's very helpful. But LifeGift, again, those organizations, wherever you work in the country, if it is in this area, it's LifeGift. They help with these things. Okay, so get them involved. Okay, they can if they're not physically present at your facility, ask them to email you information. They may want to talk to the family on the phone. Do all those kind of things. Just help support the families. Okay. So often don't overlook just your presence and how much that can help patients in their bereavement. Okay. Just offering a listening ear or connecting families with those support services like LifeGift or a chaplain, or encouraging them to call their pastor or loved ones, anything like that to support them is so important. And don't underestimate how important that can be. Okay. But our presence and support can make one of the biggest differences in the family's lives. Okay. They're going to, and I love the phrase, and I use this, I've applied this to my life, and I really think you guys should too. Always remember, people don't remember the words you say. Okay. So don't worry about, saying the exact perfect right thing to people in their grief or in this process. They don't remember. Patients and families don't remember the words you say, or maybe not even the actions you do, but they're going to remember how you made them feel. So if you approach them with kindness, with respect, with the empathy, showing that you have time for them to listen to them, they're going to feel valued. They're going to feel like you cared. They're going to be more at peace with the process and the decisions they made later on, versus you rushing them to make a decision. You act like you don't care. So if you don't care about them, then you don't care about their loved one. And it's not good for anybody involved. Okay. We don't want to be creating any more trauma for the families and the survivors of, a tragedy. Okay. So just some reviews and key takeaways, okay? So in summary, okay, we highlighted the importance of the nurses in the organ transplantation process, from understanding the legal and ethical frameworks established by the National Organ Transplant Act of 1984 to those practical aspects of like the donor identification and the care that we need to give recipients, okay? We also discussed the important distinctions between brain death and circulatory death, with a focus on how brain death is defined and legally recognized in Texas. Okay, it's very important that you guys remember those definitions. As a critical care and or emergency nurse, you guys are going to be responsible for including not only the clinical aspects of the transplantation, but the emotional and psychological support to the patients and their families, okay? This includes building those therapeutic relationships, communicating effectively, and offering compassion, particularly in those difficult circumstances. Okay. Compatibility and post-op care are also important, where your knowledge and the vigilance of monitoring the patient is going to make the biggest difference in patient outcomes. Okay. So you guys need to be sure that you're helping to ensure that the success of the transplant and the well-being of the recipient is in your focus, okay? In addition, you guys need to remember the importance of supporting the families of the deceased donors. Don't forget about them, okay? We need to honor their contribution to saving lives and recognizing their unique needs during the grieving process. And the only other thing I'm going to add is, I know if you guys don't know what an honor walk is, go look it up. There's YouTubes of it, TikToks of it. Honor walks are something that are like, it's an amazing gift to the families of the donors and the friends and family. And they will often ask staff to be present during the honor walk. And this is the last walk from the ICU room to the OR before they go to procure and obtain the organs. And the family often follows behind the patient as they're walking down the hallway, and the critical care transplant nurse team, whoever it is involved, the patient's probably still, hooked up to all sorts of meds and stuff, and you're taking them to the OR, but lining the hallways, they ask anybody to honor the sacrifice of the patient, the donor, and the family as they walk their final walk to the OR. It's emotional. It's hard, but I think it's important that we participate and, again, honor the families and the sacrifice and the donation that they're making to help save others' lives. Sometimes it does give families some peace and like comfort, knowing that like their loved one is moving on and living in somebody else. And it's really hard not to get emotional during honor walks. But you guys, if you ever have the opportunity or asked if you would like to participate, I just want to encourage you to do so. Okay, that ends Module 5A. Don't forget to review the readings assigned and the learning objectives before we have our lecture.